So, good morning, good evening, good afternoon, everyone in various time zones, our avid listeners, and our wonderful viewers who have been watching us through YouTube. Hello and welcome, everyone. We welcome you to another episode of Experts Interview by LTD Care India and 50 Plus Asset. With me is my lovely co host, Pankaj. So, today's topic that we are going to discuss is increasingly becoming important in today's time, where we're talking about dementia care, but talking about dementia care neighborhoods. And when we think of dementia care, we all usually think about hospital setups, maybe medication, nursing home, you know. But what if the entire community becomes the part of it? Part of the care system itself. So how does it happen? So I'm really excited because, like you guys already know, dementia is something that is really close to my heart and something that I've dealt in my personal life. So we welcome Meri, who is an executive director, certified Alzheimer's care disease specialist, dementia care trainer, certified dementia care manager, and co-creator of a wonderful system called as DementiaBuddy. On to my lovely host Pankaj.
Thank you, Dr. Mrigna. And it's a pleasure to have Mary on the podcast today, all the way from Pennsylvania. Mary has been a great supporter for Elderly Care Initiative, and I have also been following her work. And with the recent Dementia Care at Home posters, which I was just talking to her and saying that yes, it is making a lot of impact, at least for the people who really want to understand that subject, because there is no end to it. And we really look forward to a lot of learning from the experiences of Mary, because she's a senior executive and a senior professional in this sector, especially in the healthcare organizations. And she's had multiple roles, from the administrative, handling the administration, to handling the staff, to handling the volunteers and the operations. So I think full 360 degrees understanding of this subject is something which we are really looking forward to from Mary today, and also the American learnings. So welcome, Mary. Welcome to the
Thank
show.
you. Thank you. I'm honored to be here. Um, I was born in Albania. I live in America, but my heart is global. And the subject matter today affects all people around the world. So thank you for inviting me to this platform.
So,
So
so Mary, the first question to you would be, because you've been involved with various organizations and in various capacities. So, last what I saw and which I've been seeing is you've been associated with the Anne Silverman community. So, can you just tell us a little bit about this particular initiative and how you are associated with them?
Yes, thank you. I serve as the executive director of the Ann Silverman Community Health Clinic in Bucks County, Pennsylvania. We are the only free healthcare clinic in our county, and we provide medical, behavioral, dental, vision, and prescription services to uninsured adults and children who otherwise have limited access to care and would fall in the gap of uninsured. Our mission through the clinic is to remove barriers to healthcare and improve the health outcomes for vulnerable members of our community. Last year alone, we served 2,600 uninsured residents right here in Bucks County, representing dozens of nationalities, languages, and they come to us. We restore them to health through the integration of all those programs. This is made possible primarily through our volunteers. We are a volunteer driven organization, 32 years old in Bucks County, and we have over 234 dentists, doctors, psychologists, clerical, and otherwise. Through the many hours, thousands of hours of these individuals, were able to sustain exceptional healthcare for our patients.
That's very inspiring, Mary, to be hearing about it. I think it's very interesting to understand that in countries like US, where we see, a lot of immigrant population coming in all the time, the need for free clinics and the need for this kind of an initiative. So I think it's probably very highly appreciated, and it should be. So for me, the question I would like to know about, or the thing I'd really love to know about from you, would be talking about the dementia friendly communities that you're setting up, that I'm really excited to know about. So I and also our audience would really like to know how this whole idea came up, or what inspired you to start this, and how does it actually works.
That is a wonderful question. Back in 2015, I noticed that facilities are limited in providing care just by sheer numbers. An average facility can care for up to 100 patients, but most of the communities have people with dementia in their neighborhoods. So I began to see people with dementia in restaurants, in stores, in banks. And this idea came to me that Dementia Care Neighborhood, which now I developed into Dementia Care at Home, was developed around a very simple and powerful idea. Dementia care should not be delivered by a single individual or family member working in isolation. It's a burden, it's sustainable only through the effort of a community. So the program was focused on creating a network of support around individuals living with dementia and their care partners. We brought together healthcare providers, social workers, legal professionals, mayors, nonprofit, for profit, home care agencies, faith communities, volunteers, and family members. We would be amiss if we did not bring people that have dementia. We need to hear their voice so that we can better represent and understand their needs. So, through my role in this development, I was able to bring awareness into the needs and the education that platforms that must be provided for all these sectors: caregiving, coaching, care planning, and helping families navigate the complex healthcare and long-term care systems. One of the greatest lessons that I learned is that dementia care is not simply about managing systems or symptoms, but it's about preserving dignity, identity, purpose, and quality of life till the very end. Today, I continue my work with dementia care at home because I do believe that dementia care belongs, the future of dementia care belongs at home. By sheer
I think it's
numbers, yeah, we
yeah.
see.
No, I think it's beautiful. I just wanted to say the whole thing to say that dementia care future relies at home. I think bring us to this core point of it, Mary, very honestly. And a lot of time we think care facilities, of course, they're trying to do the best they can, because we do need an engaging ecosystem into working with all of this. But it's interesting to understand, the at the end of the day, it's the home care ecosystem that needs to take over, especially when comes to something like dementia. And it needs to be an ecosystem. When we say it cannot be an individual, the burden cannot be left to a caregiver, individual, various, like if we put everything together, the faith communities coming together, various people coming in, groups coming in together. And I think this is actually what we need in everywhere. I would say not only in US or in India or in Brazil. I think everywhere that this is what we need. So you're working with these people, with this from profound communities for such a long time. What is that really one lesson that you have learned, especially working with somebody with dementia?
The people that have dementia need to be understood, loved, validated, and assured that there is someone walking the journey with you. Through that, we are able to accomplish the goal of preserving dignity and maximizing independence till end of life.
I think very well said, Mary. Uh, because when you're talking of a neighborhood level, that is, I think, that is the first step, which is the most important element. We all don't go out outside the colony every day or the neighborhood, but it is that respect and the involvement of and the education level of the community at large. I think that really makes a lot of difference. So just wanted to understand as to when you talk of a neighborhood, you have people from all walks of life, people from all different age groups. So, as a person who has, let's say, initial dementia, and I'm going to a supermarket, I'm not able to decide which what to pick it up, or if I'm going to the billing counter and saying, "Oh, okay," or get confused. So what is the acceptance level or the education level of an average person in a neighborhood who can actually relate and say, "Okay, don't worry, sir, we understand." Uh, look, obviously, you're not telling the person you have dementia, but they understand the symptoms or they can relate that, okay, this person has dementia, so I need to show empathy and I need to show patience. So, how does that ecosystem work?
I wish I could say that everyone is fully aware and supportive of people with dementia, but that is not the case. A lot of work is ahead of us. We need to continue bringing awareness to restaurants, shopping centers, business owners, and invite them into platforms where they have a voice, they have questions answered, and they are willing and open to make these dementia friendly communities everywhere. So the work is plentiful, and we need workers that will show up and say, teach me, show me, let me be part of it. But I do believe that hope is there. If all of us, people like you and people in your community, Elder Care India, and around the world will join hands and come together to say, this there is a need to bring this awareness around the world, but it begins with me and my neighbor. So if all of us could start looking into our neighborhoods, our people, our gyms, and begin to bring awareness to our conversations, it would be the first step. Part of this initiative inspired me to create International Dementia Care and Cure. And this is going to be a platform where all of us from around the world can share our resources and our encouragement for our communities and for the future.
So I guess is that one of the reasons why you are writing your book, which is coming in, that is led by love, guided by faith. I love that title, led by love, guided
Thank
by
you.
faith.
Thank you. I really believe that care partnering, caregiving is a difficult journey. And unless you're inspired and sustained by unconditional, relentless love and faith, you become broken and burned out. So my book was an attempt to bring a collaboration. I co-authored the book with a caregiver. And I've known my co-author for 15 years. She cared for her mom, her dad, her mother-in-law, and she brings stories and her perspective, and I follow up after the story with guidance on direct dementia care. So we're excited. This is the first book of this collaboration where you see a coach and a partner writing together. So I'm hoping that it would be a blessing and a guide for everyone that is caring for someone with dementia.
it's really intriguing, and it's really, really something new, I would say, because I haven't heard about books like that, to be very honest. And I think it's very practical for individuals who actually need, you very rightly said, we all need a little inspiration and faith to continue on this journey, because otherwise it can really burn us out as individuals. And I think that's a very well put up point. So, paint me a picture here. If I'm walking through, let's say, in an ideal world with the dementia care neighborhood, what would I see? What would I hear? What would I experience as an individual, or what is the ideal we want to work towards?
Dementia-friendly neighborhoods begin with small signs and symptoms and guide graphics that identify both the need and the help. So I have partnered with local restaurants who have, this was not my original idea. Dementia-friendly neighborhoods is a movement. But locally, I partnered with restaurants. I visited with over 20 restaurants, and I asked the owners, when is the slowest day in your business? And they each gave me a particular day. So I pursued them and asked, how would you feel if we make Tuesday, 3 p.m., a time where someone can come in and celebrate a birthday or an anniversary, and they have dementia? So what that would do is allow a more comfortable, low sensory input environment for people with dementia. It would allow them to feel normal. It would give them the opportunity to walk the streets and restaurants where they've lived for 50, 60 years. It brings families together to say, I still matter, I still live, I still have purpose and joy. But also it's a win-win for restaurants because it provides some type of business during the low hours. This initiative started about 6 years ago in our neighborhood. It took some time. COVID didn't help, but to everyone's surprise, owners are open to innovative ideas. They are touched that this is a sector that has not been developed before. And my hope and courage is that families, owners, local communities will continue to partner with ideas like this. My next initiative is right now working with a hospital. And this is a 100-year-old hospital. It was not founded yesterday, but yet there is no dementia-friendly initiative. So if I'm walking in a hospital and I'm bringing in my mom with dementia, how would the staff or my mom react if no one knew that she had dementia? So we are creating awareness. We're creating signs, forms, and ways that expresses in real time if someone has dementia, what kind of help will be there for them. I'm very excited about this initiative. When it becomes successful within the local hospital, then we're going to go to other local centers and healthcare providers.
I think it's an amazing way to take this initiative forward, starting from the restaurant to the hospitals and to the other community areas. And I can relate to it very, very, very much because one of my uncles who developed a full-blown dementia over the years, and whenever we used to take him out to a restaurant, and I'm talking of as late as probably 4 5 years back, go to a restaurant and the caregiver obviously will be holding him and taking him over. The education was such that people used to actually stare at him. Okay, there's something wrong with this person. And then some of them, being India, we are a little extra nosy when it comes to inquisitiveness, I would say. Some waiter will come and ask, sir, is there something wrong with this him? Because I don't actually see, but still there is something wrong. So I think what you are saying is sensitizing the establishments of various service providers is something I think it's very, very critical, and it makes it more inclusive, I would say. So beautiful, beautiful, beautiful initiative. Coming to my next question, which is actually my the reason I came into this sector was senior living. And in your previous avatar, you were associated with a five-star uh, residential facility, Pickering Manor, which offered all the levels, independent and assisted and nursing care, which I believe it's called CCRC. I don't know whether it was called a CCRC, but I am really, really keen to understand how that particular facility works, especially as a five-star level, because five-star levels are still not very much, I believe, even in the US. They are expensive, but something like Pickering Manor. So, can you just tell us how the flow was and what kind of people used to come and what were the different levels over there?
It does bring me joy to talk about Pickering Manor. That's where I learned what it means to have dementia, how to care. That's what I learned what to do and not do. And I have a very warm spot for that community. I grew as a professional. I learned all the ways of care partnering and leadership. It's a beautiful community run and operated five-star facility in Bucks County. It is a CCRC, which stands for Continued Care Retirement Community. And the United States generally offers a continuum of care designed to support the older adults. And you have the CCRCs throughout the United States. What that means is the beginning of care starts at when you retire with independent living, apartments, cottages, and then it continues into personal care, memory care, skilled care. Within the skilled care, you have palliative care and hospice. So in this case, from 60-year-old till God takes you home, you can stay within this community. And one of the strengths of Pickering Manor is that residents can often move from these levels of care while remaining within the same community and recognized system, providing continuity, familiarity, and peace of mind for the families. I was very honored to open the memory care at Pickering Manor. With the support of the board and the leadership, I was tasked to design, create the systems, the programs, as well as the interior design. So that forever will be my most favorite projects I've worked on. I would like to mention one component. When I was tasked to create the memory care, I brought in a group of people with dementia who have experience in interior design. So it was the residents that picked the colors, the curtains, the decor. It was the residents that picked the patterns of the garden, the flowers. And seeing it from their perspective became more pertinent, more practical, and more personal. And my tagline for memory care was to live the life you love as a resident, not the life we want you to live. And that tagline followed my mission and my programs that I designed in the memory care. It continues to be one of the best memory cares in Pennsylvania.
No, I think it's very beautiful. And when we talk about, when you were talking about the project, I was very curious. I was like, oh, let me ask her about the interior designing, what things she took care of, how she managed. And you answered yourself, saying you asked the residents to pick up those who have experience in interior designing, which I think also not only gives it the warm touch of being own house, because that's what we love about our house, no? That we decorate it ourselves and it's ours by the end of it. So I think that not only it brings that warm touch to it, but it also brings the fact that there is a sense of I have seen we have seen in India also there's this beautiful concept of CCRC coming in and everything, but at the end of it, there is a life proposed to the individuals, and they're supposed to live that life versus the fact that there is a life that they are building for themselves, which I feel is gives them that sense of independence and that sense that they are the ones who are in charge, even though they might be living in a facility where eventually they know they'll be dependent, they have dementia, it's progressive degenerative, and everything else around it. Or even if not dementia, any other neurological disorder or physical disorder in that matter, that they know eventually physically, mentally, emotionally, maybe for their daily needs, they'll be dependent on somebody else. But having this kind of I think a sense of independence is I think what I got my answer from makes it 5 star, no, versus any other place. So thank you for this information. Tell me a little more about this place, since we're very curious to know about the memory care unit that you designed. What were the components? How did you picked up those components? And how you decided on what part to bring into it is something I'm very curious about.
Sure. So memory cares. Let's start with the name. I don't particularly like the name memory care, but changing the name would have confused the consumers. So we did keep the name. Memory cares at the very core should be a miniature slice of your own personal life, a sample, a grouping of all the components that you bring as an individual. So personalizing all the elements of life in the memory care made it successful. We had very few behaviors and 0.3% falls. This results did not happen in isolation. I contacted and I interviewed the families and the person with dementia a couple months before we planned for them to come to the memory care. I would go to their home and interview them in their space, in their home. And I did that intentionally because I wanted to see the very best they could be in their own environment. And once you get a baseline of their highest functioning level of need and care in their home, then you can go from there and build the care plan. Most of the facilities have preset furniture. I refuse to accept that. I would work with the families and intentionally choose pieces of furniture that they can bring to the memory care. When the person with dementia woke up, I wanted them to wake up in that same chair, cuddle with the same blanket that they have for the last 10 years, with the same lamp to their right, the same book to their left, the same cup of coffee, the same curtains. So the orientation, instead of having an average time of getting oriented in memory care is 2 to 3 months, we were managed to get people oriented to time, place, and person within weeks, sometimes within 2 weeks. So by doing so, you're eliminating or diminishing behaviors, you're bringing quality of life, and you're helping ease the anxiety of the families. Families are very anxious when they trust you with their loved ones. When they come and visit and they see that they are happy, they're enjoying activities, they love their room, they get oriented to where things are. Even families can go home and say, I can sleep at night, my mom is cared for. I also partnered with a Dutch company. The Dutch company was able to design personalized door signs for our residents. So this company is called True Doors, and we were able to take pictures of the front door of the family, send the picture to True Door Company in Holland, and within a couple weeks, they will send us back this decal that we would stick at the front door. We placed mailboxes right outside the entrance, and on the mailbox, we placed the address of the person with dementia that of the home that they lived in when they were young. Because people with dementia, let's say someone is 70, they think they're 30. So when you ask them where is home, they will give you the address that they remember when they were 30 or 20. Little components like this made the difference. They would know where their room was because it brought about a memory that they have from their youth. And we had no problem with orientation. So I would support True Doors has been one of the best finds for me as a memory care provider. And I have nothing but good things to say about them. They are in Holland, Europe, not Holland, PA. So I'm giving a shout out to that company.
I think it's a really great insight, Mary, to be very honest. I've been in the planning sector for senior living from the past 20 years, and putting up the entire door image is something which I think takes it to the next level. And I think that is the level of personalization which is required, especially in dementia. So really, really, I'm sure once we convert this entire podcast into Hindi and other languages, a lot of people will understand the relevance of these finer aspects of dementia, rather than just thinking, oh, it's a memory loss issue and it's a mental illness. So thank you very much for that part. So my last question to you, Mary, would be, which is something which I always want to hear from all our American friends or from the UK or the Australia. You have been in this associated industries for so long. So how do you think the policies are made for these CCRCs or the assisted living or the nursing care in US? Are they service provider friendly, user friendly, or they can be a little pain in terms of implementation? So I would just find that is my last question to
I
you.
guess we can talk about the hard topics, and this is a difficult one because life is not life within a memory care or CCRC is within the confinement of regulatory matters. And the United States is one of the most regulated elder care systems in the world. Senior care is second most regulated industry after the nuclear. So this is both strength and a challenge. The regulations help protect vulnerable older adults by establishing standards of care for quality, safety, staffing, infection control, and residents' rights. However, from the perspective of families, the system can be extremely complex. Different services are funded through different programs such as Medicare, Medicaid, private insurance, long-term care, aid and attendance, which is a program for veterans, as well as personal resources, private funds. Rules often vary by state, and families frequently asked to make important decisions during times of crisis. So, the complexity is one reason why care managers, patient navigators, elder care attorneys play such an important role. And they help families understand this option. My hope is that the future systems become more integrated and easier to navigate and more person focused. One of my, I'm jumping for a second from America to Holland. One of my favorite places is the Dementia Village in Holland. And some of the components of this village inspired how I created the memory care. But because of regulatories, I couldn't fully take all the components of the dementia village and adapt them here. So there is more work to be done. But for now, I could say that the system is needs to be understood, supported, and communities are struggling right now because the reimbursement rate is not what it used to be. We see long-term care facilities getting sold or bought. Um, so the future is ours to see where this is going. With the silver tsunami, I don't believe the systems within even the United States are prepared to face the 10,000 people turning 65 every day. And that's why I really think we need to be open to collaboration more with the private sector and long-term care sector. Instead of looking at each other as competition, we need to look at each other as partners and integrate the stages of care where the need is maximized with supportive services.
I think that's very beautifully said, Mary, that rather than looking at each other as competition, it will be great if we can start looking at each other as partners, collaborators, working towards the same beautiful end goal, So, what would be your 2 cents for our viewers, our listeners, who are families with dementia and who are right now maybe struggling in their homes or I don't know, in care facilities, wherever they may be? What are your 2 cents or your advice to them?
My deep encouragement comes from my heart. The journey is not easy. It's hard. But begin with understanding and awareness of different types of dementias, the length of every dementia, and the manifestation of signs and symptoms. Going into a general practitioner who will tell you you have dementia, there's nothing you can do, go home and forget about it, is not the right type of provider. Begin with a provider that is willing to walk this journey with you and your family. There are over 100 types of dementias. We would be amiss if we group them together to say, oh, if she's got dementia, just go home and deal with it. So I really encourage providers to themselves become more aware of what does it take as a care partner to care for someone at home. How can you as a provider support the families when they come to your office? 8 minutes is not going to cut it. Some insurances, that's all they cover. So my hope is that primary offices, long-term care, healthcare centers would bring more awareness, that we would have platforms that together we can share that information and give tools to people who are in the trenches of dealing with dementia every day. I really think that a society can be measured by how it treats the most vulnerable members. People with dementia need our support, they need our protection and awareness. So, whether we are caring for someone with dementia, chronic illness, or the challenges of aging, our goal should be the same: to preserve dignity, maximize independence, and ensure that no one walks this journey alone.
I think very beautifully said. Brings us to the end of this podcast. Thank you so much, Mary, for your time. And it has been an incredible discussion with you, understanding such beautiful perspectives and moving ahead with more tools, more willpower, and more strength, I would say, is what we wish for you. And today we have learned that dementia is not only about the treatment and the support, it's also about dignity, belonging, creating those safe communities where people can continue to live meaningful lives. And thank you for sharing your expertise with us. From us, it's a goodbye. Thank you.
Thank you. We'll
Thank
talk
you,
again.
Mary. It's been an absolute honor to have you on our podcast. And personally, I learned a lot because the focus on dementia care neighborhood from our perspective has basically been more on the infrastructure planning. But I think we forgot the larger picture or the core point, that is that people need to understand what dementia is. I could have made the building accessible, I could have made all the signages, but if you don't relate to the relevance of them, then I think all the planning goes for a toss. So, with that, really, once again, thank you for coming on the podcast, and we look forward to your continued support, Mary. Thank you very much.
Thank you. Have a
Namaste.
beautiful
Thank you.
day. Bye-bye.
Thank you.